Hello and welcome. My name is Rochelle and we are AMCI. We're presenting to you today the 2021 Evaluation and Management Changes with Auditing, putting the fun in evaluation management fundamentals. You will be joined by our presenters today. We have Ms. Tracy. Ms. Tracy is the Assistant Curriculum Director at AMCI. And of course, our pleasure to be joined by Mrs. Camille Jackson, most commonly known as Mrs. J, and she is one of the founders and curriculum director here at Absolute Medical Coding Institute. They will be joining you very shortly. But first, allow me to read some copyright. CPT is a copyright of 2020 American Medical Association. All rights are reserved. CPC is a registered trademark of APC, and APC content found within this presentation is a copyright of APC. Now, some information about E&M CEUs. By attending to this two-part webinar, you will be granted 3 CEUs. And if you are joining us for the entire bootcamp, you are eligible for a free evaluation and management course courtesy of AMCI. That will be worth 22 CEUs. And that is our thank you for joining us for this event. Now, if you haven't downloaded the handout yet, you do have a handout and we have provided for you, or you can go ahead and scan the following so you can get your PDF copy of this file. You will be needing this for this presentation. Thank you very much. A few disclaimers. So, attendees should already have a basic understanding of E&M coding prior to this lecture. We will answer questions in the chat. However, due to the high numbers in attendance, we may not be able to answer all questions, but we can answer that after the event has ended. The overall intent of this presentation is to provide attendees with a thorough understanding of the available 2021 E&M changes according to AMA guidelines. So, if you have any further questions about this presentation, please direct us to us at www.absolutecodinginstitute.com/contact us. We appreciate your feedback. All right, now it's the time for me to turn you over and we're going to get started with our presentation. So Mrs. J, whenever you're ready, please take it away.
Thank you, Ms. Rochelle, for the introduction. I'm Mrs. J, and it is my pleasure to be one of your facilitators today. Now, before we get started, let's come up with a name that I will refer to you as. So I did some thinking, and I thought that E&M experts would be a good name for you, a good name to call you. So what do you think about that? All right, so if you accept that, then understand this. I do instruct medical coders a lot, quite a bit, and I may just slip up and call you coder. If I do, please forgive me in advance, but in this realm, I want to refer to you as E&M experts. Why not claim it, right? All right, so again, you know that there are 2 parts to this presentation, and this is the first part, so let's review the goals of part 1. We want to review the 2021 changes for office visits, evaluation and management office visits, demonstrate basic E&M auditing, and hopefully we'll bring you one step closer to 2021 E&M ready. All right, let's get started, experts. All right, so in this presentation, we will review changes that will take effect January 1st, 2020. And this presentation will include the following. Well, you've got some introductory guidelines for code series 99202 through 99215. We are going to review that revised code language for the code series 99202 through 99215. And because we don't have the time to do a comprehensive evaluation of those guidelines, you are welcome to look at the complete version. And right here, this is your link to obtain your complete version, or it's in your handouts, or this nifty little QR code. You can just screenshot it for later, or you can scan it right now. I'll give you a moment or two to do so. 3, 2, 1. It goes away. And finally, just remember, the content that we discuss will not be included in your 2020 manuals. Again, remember, these are 2021 changes, so you'll find them in the 2021 manuals. So if you want to follow along, go ahead and use the handout, and we will try to guide you accordingly. All right. Are you ready, experts, to get started? All right. So, why the change? Why are we changing from the old E&M guidelines to the new? Well, physicians can potentially benefit from this change. They'll have a lighter load, and them having a lighter administrative load or burden, they can spend more time with their patients, right? So that's excellent. Thanks to CMS's overhaul of the Medicare coding documentation guidelines, physicians can do it, and they can ultimately get back to being more patient friendly and less likely to burn out. So this is great news. All right. You know, I just realized that this doctor's eyes move. Okay. Well, thank you. And just in advance, Ms. Rochelle, she does a wonderful job with these visuals. So that is who we can give credit to. All right, so again, we know that the benefits of these changes, the greatest benefits are a reduction in administrative burden, meaning the doctor is not going to be so focused on documenting, right? So, did you notice your doctor right now may be tuned into that computer a little much? Yes, I think it's too much. And I'm glad that there will be a reduction in administrative burden and the doctor can focus more on that patient. All right. So, that is why we are changing. That is why the guidelines have changed. Coders, see, I just called you coders. Sorry, experts. It's time to talk about the 2021 guidelines and what they pertain to. These guidelines pertain to office visits and prolonged services. Yes. So we've broken down this presentation and we're going to talk about visits in the office code series 99202 through 15 and code selection. The code selection will be based on one or of two items. It's either going to be based on total time of an encounter or MMM. You know what, coders? I'm not going to define what MMM is because now we're going to just talk about one of these items. We're going to talk about total time of an encounter. All right, so I'm going to hand it over to Mrs. Tracy and take it away, Mrs. Tracy.
Okay, thank you so much, Mrs. J. And we are going to have a little quick discussion regarding time. So this is one of those significant changes in 2021. So in 2021, the doctor is going to be able to choose whether their documentation is based on the MMM or total time. And just remember, this applies to office visits only. These are the activities that the doctor can include as part of their time. Okay, so the physician or qualified healthcare practitioner. So first of all, preparation, that would be the patient chart review. So reviewing of a patient's charts, as well as acquiring a history from someone other than the patient. So it might be a parent or a guardian. Number 3, conducting a medically appropriate history and exam, and Mrs. J will discuss that with you a little bit later. Number 4 is writing orders. 5, communicating with other healthcare providers. 6, clinical documentation. 7, interpreting results from diagnostic tests. And 8, coordination of care. Okay, so let's go ahead and take a little bit of a look further into these codes. So we're going to start off with our new patient office visit codes, and just notice that blue triangle there. That blue triangle means there's some revised text here. Now, the major change in 2021 is that this 99201 code, that has actually been deleted, okay? So that was one of the biggest changes in 2021. Now, each one of these codes are outlined with a time. So if you are using code 99202 and the doctor is using the time as their determining factor here, that physician needs to spend at least 15 to 29 minutes of total time with the patient. 99203 is a total time of 30 to 44 minutes. 99204 is 45 to 59 minutes, and 99205 would be 60 to 74 minutes. Now, anything beyond 75 minutes or more, you would need to see the prolonged services code 99XXX, and we will dive a little bit deeper into that in our next discussion in part 2, okay? Now, here are the times that are outlined for our established patient codes. 99211, there is no time documented. Okay, and we know that this 99211 is the nurse's code, okay? There is no time here. And if you go to 99212, the total time would be 10 to 19 minutes. 99213, 20 to 29 minutes. 99214 is 30 to 39 minutes, and 99215 would be total time of 40 to 54 minutes, and 55 minutes or more, you're going to see that prolonged service 99XXX. Now I have a quick exercise for everyone. So I'm going to read this scenario to you all. I'll give you a minute. Type your answer here to us. Let us know what you think the code would be. We have a 60-year-old woman arrives to see Dr. Lung, a pulmonologist, for an initial visit. The patient has a constant cough due to smoking and some shortness of breath. No night sweats, weight loss, night fever, chest pain, headache, or dizziness. She has tried patches and nicotine gum, which has not helped. Patient has been smoking for 40 years and smokes 2 packs per day. She has a family history of emphysema. An extensive 3-system exam was performed. Dr. Lung discussed in detail the pros and cons of medications used to quit smoking. Prescriptions for Chantix and tetracycline were given. A chest x-ray was carried out. The physician read the result, then ordered a cardiac workup because he suspects heart disease. The physician diagnosed the patient with COPD. The patient was advised to quit smoking and follow up in 1 month. The physician spent 55 minutes during this encounter. Select the appropriate CPT code or codes for this encounter. So let's code this encounter using the time guidelines for 2021. And I'm going to give you 1 minute, and your time begins now. Good luck. Okay, everyone, that is time. So what are you thinking on this one? So let's go ahead first. I'm going to go to my next screen. And as you can see, this is an initial visit, and this physician spent 55 minutes with this patient. All right, so we know that this is a new patient, so we're going to pull out those new patient office visits, right? 99202 to 99205, and we're going to look for the 55 minutes of time in order to use the time for this encounter. So that falls right here at 99204. Total time is 45 to 59 minutes. That falls within that 55-minute time that physician spent with his patient. So that is our answer, okay? So 99204. That was pretty simple, right? So the final takeaways on time-based code selection, remember it is based on total time of the encounter. Total time of the encounter, not 51% or more of the encounter as we are typically used to in our previous guidelines. So moving forward in 2021, just remember it is total time. And these guidelines only pertain to the office visits, code 99202 to 99215. Now, I'm going to turn this over to Mrs. J to continue our discussion on the 2021 changes.
All right. So now that you know how to review provider's documentation and select the code based upon total time, now let's turn our attention to the MMM. And some of you might be saying, what is she talking about? I'm going to explain to you right now. What is MMM? MMM is the acronym for Medically Appropriate History, Medically Appropriate Exam, and Medical Decision Making. Yes, coders. I'm calling you coders. I have to stop it. Either I'm going to master this expert or not. Please forgive me. All right, so this is what MMM means, and this is how we're going to review documentation for code selection if we don't use total time. And medically appropriate, you say, what is it? It means at the doctor's discretion. Yes. So for 99202 through 15, goodbye hem. We do not use history, exam, or medical decision making. No, we will use MMM. MMM are your 3 key components, the new 3 key components. Yes. Now let's go ahead and talk a little more about the MMM and the way we're going to do it. We're going to take a look at the 2021 code language. That'll help us. Now, as Mrs. Tracy said, that 99201 has been deleted and we will need to report 99202. The powers that be have determined that 99201 is too similar to 99202 and it's not needed. So remember, experts, this is a major change. Now let's turn our attention to the code language. And first, let's look at the code. You see that blue triangle? That means that is revised language. And of course, that star, that's telemedicine. Now, let's look at this new code language. First, you'll see medically appropriate history and or exam. All right, so a key change is medically appropriate. It means at the doctor's discretion. Now, experts, do you see anything else there? Anything else significant? Well, they're saying history and or examination. So at minimum, you must have a history or exam, and I can tell you that pertains primarily to patients who are established, all right? Yes. Now, let me go back to medically appropriate. So when you say at the doctor's discretion, or when I say it, I'm saying, yes, the doctor can say, I conducted an exam, and that's it. The doctor actually could have told the patient, cough. And if the doctor determines that's enough, then it's enough. It is the doctor's discretion. And you know what? I am not making light of it. That's what it is. Yeah. So it's at the doctor's discretion. All right. So next, if you look at the medical decision making, it has not changed at all. And again, that total time feature, that changed too, as Mrs. Tracy reviewed with you. So the medically appropriate history and or exam and your MDM, that is what is needed for the MMM, and the changes actually pertain to the medically appropriate history and or exam. So let's go ahead and look at all of the codes. Oh, before we do that, I like to qualify what I'm saying. So, Mrs. J, how do you know that this is solely up to the physician? Well, the documentation guidelines say so. It says that it is determined by the treating physician or other qualified healthcare professional reporting the service. All right, so they're right in your guidelines, in your handout, okay? And I believe that's on page 1. And don't forget, it means at the discretion of the physician or qualified healthcare provider. Now, coders, I am going to make an announcement. The announcement is that if this is true, that all you need is a medically appropriate history and or exam, then your code will be primarily driven by the medical decision making. All right, now I'm going to show you the code series and I'm going to prove why that is correct. Now let's take a look at code series 99202. It says you need a medically appropriate history and exam, and all of the codes in the new patient section say the same thing, medically appropriate history and exam. But what's different? What's different is your MDM, right? So if the difference is the MDM, the medical decision making drives the code. So for code 99202, the MDM is a straightforward MDM. 99203, the MDM is low. 99204, the MDM is moderate. And 99205, the MDM is high. Okay, experts, I'm going to let that marinate. And we're going to move on to the established patient codes. 99211, well, there's no MDM. This is the nurse's code. Now let's look at 99212. The medical decision making is straightforward. 99213, the medical decision making is low. 99214, the medical decision making is moderate. And 99215, the medical decision making is high. All right, experts, I think you're ready for a scenario, so let's get to it. The patient arrives to her PCP's office with complaints of constipation with nausea and vomiting when taking Zovirax for her herpes zoster and Percocet for pain. The PCP documented a detailed history, comprehensive exam, and a medical decision-making of moderate complexity. Which E&M service is reported in 2021? Okay, experts, I am going to give you a minute to solve this scenario. Go ahead, type your answers in the chat. How did you do experts? Did you need more time or did you get it in record time? I know you did. I know you got it. All right, let's solve this scenario. Our scenario will be on the left. And let's go ahead and highlight our key terms because we have to document your three key components, your MMM. And in this case, we had a detailed history, a comprehensive exam, and the medical decision making was of moderate complexity. Now, remember, all the doctor has to do is document a medically appropriate history and or exam. And in this case, the history is documented and so is the exam. It doesn't matter what type, just having those two will substantiate the requirement. Now let's go ahead and pull up our code series 99211 through 99215. And if we look at a glance, 99214 is the correct code. It's the correct code because this is the code that has the moderate MDM, right? Yeah, so this is a moderate level of medical decision making. So this is our code. 99214 is the answer. So how do you feel? How do you feel about these changes? Yes, I love it. I do, I have to say. Now let's go ahead and summarize. The summary of the general code changes for 99202 through 99215 when you are using MMM, the three new key components. Number one, remember code 99201 has been deleted and providers are directed to use 99202. Number two, the code language has been changed. You have to remove the hem requirement. And remember, experts, this only pertains to office visits. Code series 99202 through 99215. All other encounters use the hem. Yes, the three key components, hem. And finally, remember, the MDM remains the same. I have a question for you. So pretty much so far, our documentation has been cut and dry, right? So we're able to select the MDM or determine the MDM, then we get our code. But what if the documentation is not so cut and dry? What do you do? What do you think we do? Well, if you said audit outstanding, and before I go on, I don't want to distract you. I'm distracted, but I'll tell you later why I'm distracted. All right, so we're going to audit, right? And we know that in 2021, you don't have to audit a history and exam. Well, if you didn't know it, you know it now. You don't have to audit it because all we are looking for is a medically appropriate history and exam. And by mere mention of it, just having the documentation, it's almost implied that a history and/or exam took place. So we don't have to audit them in 2021. All we have to do is audit the MDM. That's it. So that cuts down a lot of work. Coders, experts. Okay, let me tell you what I was distracted by. That doctor's nails. Have you ever seen such long nails on a doctor? Can you imagine that exam? Ouch. All right, I digress. Let's get back to it. Well, let's begin with the basic facts. If we're going to audit only the MDM, let's look at the types of MDMs we can have. We can have either a straightforward MDM, a low, a moderate, and a high. Same thing, nothing's changed here, right? The only thing that's changed is we don't have to audit the history and exam because they are medically appropriate as determined by the doctor, as determined by having the documentation. All right, so let's focus on the MDM. And just like before, MDMs are evaluated and audited based upon these three categories. Number one, the number and complexity of presented problems. Those are the number of diagnoses evaluated. Number two, the amount or complexity of the data reviewed. How complex was it? And three, the overall patient risks. All right, so nothing's changed there. Now, let's take a look at the new 2021 Audit Tool. All right, so it looks, well, the categories, the columns are the same, but what is different? What's different is the definitions within within the columns, so the elements, and we'll talk about it very soon. But I just want you to pay attention that this is the new 2021 Audit Tool. This is the first part of it. And at AMCI, we call it the PDR, Problems, Data, and Risks chart. All right, so just take a look at it. This is the first page. And you can also find this in your handout on pages 7 and 8. This is a replica of pages 7 and 8, and that's the official AMA version. Now here is the second page. Just want you to take a look at it. And yeah, it does look a little different. And now I'm going to tell you why it looks a little different. Well, it looks different because AMA and CMS, they have clarified those definitions within those categories that we've just seen. They have been further clarified so that we as medical professionals can have the same understanding of their meanings. And that is a great thing. So let's go on and let's learn these definitions, because understanding these definitions will be a key factor in determining the MDM. Because now, before, it was very subjective. I think it's less subjective because we have universal meanings. All right, let's look at them each. We're going to look at them according to the problems, the data, and the risk. And we'll begin with the number of presenting problems. MDM's number of problems speaks to, sorry about that, the number of diagnoses addressed. We have we have the 99211, which is not applicable. This is the nurse's code. And then we have the minimal number of problems and the low number of problems. So what makes this minimal? Well, it's a minimal problem if the documentation supports one self-limited or minor problem. Or it's a low. It's classified as low if there are 2 or more self-limited or minor problems addressed in the documentation, or 1 stable chronic illness, or 1 acute uncomplicated illness or injury. Now, we may say, well, that's simple. Well, it is simple if we all have the same understanding of what a problem is, right? So we just can't assume that we all have the same understanding. So the powers that be, they have done the following. They have come up with some definitions. In fact, they've defined what a problem is. A problem is a disease, condition, illness, injury, symptom, sign, finding, complaint, or other matter addressed at the encounter, with or without a diagnosis being established at the time of the encounter. Now, that was simple, it was straightforward, fair enough. So we all have a general understanding of what a problem is. They've also defined what a minimal problem is, what a self-limited or minor problem is, stable chronic illness, and acute uncomplicated illness or injury, and problem addressed. So this is the change. This is the predominant change when it comes to MDM. CMS, AMA have further clarified these diagnoses, well, these key terms, all right, so that you can have a more, how can I say, it's common knowledge that MDM, when it comes to auditing, it's extremely subjective. I think these definitions further reduce the subjectivity. It makes it less subjective. I'm not saying it's not subjective, but it decreases the level of subjectivity. All right, now I'm going to move very quickly with the next MDM definitions. So please, if you'd like to read along in your handout, don't forget pages 3 through 5, and I should be going somewhat in order. Okay, the next MDM's problems for moderate. You have 1 or more chronic illnesses, or 2 or more chronic stable illnesses, or 1 diagnosed new problem with uncertain diagnosis, 1 illness with systemic symptoms, or 1 acute complicated injury. And these are all moderate. And here are the definitions for chronic illness, undiagnosed new problem, acute illness with systemic symptoms, and acute complicated injury. Next, and finally, in the number of problems section, we have high classification and chronic illness with severe exacerbation, progression, or side effects of treatment, acute or chronic illness or injury that poses a threat to life or bodily function. These are the new definitions for high number of problems classification. Now let's move on to the data complexity, MDM's data complexity. For a minimal or none, we'll use codes 99202 or 99212. For limited, you must meet the requirements of at least 1 of the 2 categories. And the definitions are test. Test important. It's important that we all have the same understanding of what a test is, and external. What are they saying? What do they mean when they say external? And these represent some of the new definitions for data complexity for codes, or for minimal or none and limited. Next, let's look at moderate and extensive. The key definitions: independent interpretation. So the key term is independent interpretation, and the key definition is below it. and the appropriate source has been defined, as well as external physician or other qualified healthcare professional. So definitely read along in your handout, pages 3 through 5. And next, and finally, the risk. MDM's risk. For a minimal risk and low risk, they've defined risk. That's important. And down below, that's my definition for morbidity. Having a disease or illness and the state of that disease and or illness. Now, finally, moderate risk and high risk. And the definition that they provide, or definitions that they provide, are for social determinants of health and drug therapy requiring intensive monitoring for toxicity. These are the definitions, the new definitions. And one thing that I want to point out, for a moderate risk, they have further clarified what prescription drug management is. So if you didn't know, writing a prescription is classified as moderate. Okay, so now that we have these definitions, I want you to refer to your handout and become, accustomed to what they are. And then at the same time, we need to test our knowledge of these definitions. I know we've just learned them, but Mrs. Tracy will go easy on you. She's going to show you how to review an MDM auditing scenario using MDM and these definitions and how they'll assist you with that process. So without further ado, I'm going to ask Mrs. Tracy to take it away.
Thank you so much, Mrs. J. Great discussion, great information. All right, experts, now that we have diligently practiced the key definitions, let's get to an auditing scenario. Are you all ready? We're going to take a scenario and we're going to use the AMA auditing tool to help us through it, okay? So I have a scenario for you, but first, these are the steps we're going to follow to assign an E&M code based upon medical decision making. So the first thing we want to do is inventory. We inventory any diagnosis or signs and symptoms that we see in our scenario or our documentation. Okay, and second, we're going to inventory any procedures or services. Next, we're going to determine the problems, the presenting problems, the amount of data and complexity, and the risk using the charts. And finally, we're going to select a code or level to figure out our code, okay? All right, you ready? Here we go. Here's our scenario. A 60-year-old woman arrives to see Dr. Lung, a pulmonologist, for an initial visit. The patient has a constant cough due to smoking and some shortness of breath. No night sweats, weight loss, night fever, chest pain, headache, or dizziness. She has tried patches and nicotine gum, which has not helped. Patient has been smoking for 40 years and smokes 2 packs per day. She has a family history of emphysema. An extensive 3-system exam was performed. Dr. Lung discussed in detail the pros and cons of medication used to quit smoking. Prescriptions for Chantix and tetracycline were given. Doctor read the patient's records, including scans ordered by the patient's PCP. A chest x-ray was carried out. The physician read the results, then ordered a cardiac workup because he suspects heart disease. The physician diagnosed the patient with COPD. The patient was advised to quit smoking and follow up in 1 month. Select the appropriate CPT code or codes for this visit. And just a reminder, we are coding the encounter for 2021. All right, coders or experts, I'm going to give you 2 minutes and your time begins now. Okay, that is time. Now we're going to quickly walk through this one, okay? So let's turn to the next slide here. And here's our steps. So we're first going to inventory any diagnosis or sign and symptom. So from my documentation, my inventory is going to be this patient has a constant cough and is a smoker, has some shortness of breath, has a family history of emphysema, and was diagnosed with COPD. So I'm going to list all of those diagnoses. And then the next thing I'm going to do is inventory my procedures or my services. So there's some services here. We have an extensive 3-system exam that was performed. The doctor discussed the pros and cons of medication used to quit smoking, gave a prescription, read patient's records that were ordered from another PCP of the patient. Also, there was a chest x-ray, and the physician read the results, ordered a cardiac workup. So there was several things that were performed here. So we have them all listed right here, okay? So they're easy for us to see when we go to audit, okay? So there we go. Now the next thing we want to do is determine the problems, the data, and the risk, right, from the chart. So that's what we're going to do next. Everybody with me? Let's move on to the next slide. There we go. Have my diagnosis inventory, my procedure and service inventory. Now we're going to figure out the number of problems. All right, so the number of problems that were addressed. Well, it looks like we have, this would fall under a moderate number and complexity of problems because there's one chronic illness, that COPD with exacerbation. This patient is having constant cough, shortness of breath. So this number of problem is actually going to fall under moderate. Okay, so, and there you go. If you want to read the definition, or if you're able to grab a snapshot of this, this is the chronic illness with exacerbation, progression, or side effect of treatment. There's your definition. Our number of problems for this scenario is going to be moderate, okay? So we're going to move on. Now we're going to determine the amount and or complexity of data to be reviewed and analyzed. All right, so on this one, we're going to pull or abstract that information, it looks like from number 4, 5, and 6 under our procedures and service inventory. Okay, because this is what the doctor is doing, what the things that he's performing or the things that he's doing, okay, for the patient. All right, and I would say that that is going to meet the requirements of moderate on our amount and complexity of data. If you look under category 1 on moderate, there's 4 bullets there, and 3 out of those 4 need to have been met in order to be able to use this category 1 that falls under moderate. So let's go ahead and take a peek. So the first one, review of prior external notes from each unique source, that has been met because, read our documentation, the doctor read the patient's record, including scans ordered by the patient's PCP. Okay, so if you read your definition of external, that qualifies for an external documentation, okay? All right, and that's checked off. Now we have review of the results of each unique test. Did that happen? Yes, it says that the physician read the results of that x-ray. Okay, next, ordering of each unique test. Did that take place? Yes, it did. It said that the physician ordered a cardiac workup. Okay, so now we have fulfilled 3 of the 4 there, and that's all we need in order to code this category 1 moderate amounts of complexity. Okay, so our data complexity there. Oh, and just a little side note, if you want to see the definition of what a test is, there you go. Now our data complexity is going to be moderate. So let's go ahead and jot that down so we can remember. And we're going to move on to our final, okay, which is going to be the risk. All right, so what do you think the risk is going to be here? Well, if we look under the procedures and service inventory, it looks like there was a prescription that was written. If you look under your moderate risk, prescription drug management falls under that. So we can use that prescription drug management to figure out the level of risk, and that would fall under moderate, okay? So it looks like we have a moderate risk level. Alrighty, so now we have completed all three of those. Now our final step is going to be to select the code or level, okay, to find our code. Alrighty, so let's go to our chart here, and we're going to plug in all of our information. So remember, we had a moderate number and complexity of problems, okay, because that's COPD there with the exacerbation. We also determined that this was the data complexity fell under moderate, okay, because it those three elements were the three elements were met. Sorry about that. And there was prescription drug management. Okay, so the level of risk will be moderate. So this is pretty easy because they all fall within one row, right? So they're all on one row here. So and we have to look back at our documentation to determine if this is going to be a new or an established patient code. And that's easy because it says this is an initial visit. So definitely this will be 99204. Since it is a new visit, we're going to use that new patient code 99204. And that is our answer. Okay. So easy as pie. All right, now what if you have elements from different rows? Meaning, okay, you've inventoried all your diagnosis, signs, and symptoms in the documentation. You've inventoried all procedures and services. You determine the number of problems, the data complexity, and the risk. Okay, and then you get to selecting your code, and they are all in different elements. So you know in the last scenario, they all fell within the same row. Let's say they don't. You're going to have to use your leveling technique. Let's say your problems is low, your data complexity is moderate, and your risk is high. What do we do here? Do you think, which code do you think we're going to take? Well, in this case, what we do, very simply, we take out the lowest, which would be low, and we take the middle. Okay, we take the next code. So we don't go to the high, we don't go to the low, we go right in the middle there, and we would be coding this as a moderate. Okay, so just remember, throw out the lowest and then you code the next. And that's it. Well, that concludes our discussion for part 1. Now, let's hand it over to Mrs. J for the final thoughts. Mrs. J, let's wrap it up.
With the E&M changes for 2021, remember, these will be effective January 1st, 2021. Your E&M code selection for code series 99202 through 99215 will be based on time or MMM, and this is at the doctor's discretion. Remember, the MDM is the only part of the MMM audited. Time is based upon total time, and you have revised code language for office visits that tell you that you need a medically appropriate history and/or exam. 99201 has been deleted. MMM replaces the HEM for code series 99202 through 15. And finally, you have key definitions that have been clarified to assist you with your auditing. All right, now we're going to take a break. And we will resume in 30 minutes.